on to the last one, which is your sporotrichosis. Now, remember, I told you that sporotrichosis is also a dimorphic fungi. So, dimorphic fungi are those that are going to be yeast at 37 and mold at 25. And how will you remember it? That yeast at heat and mold at cold, because 37 degrees Celsius is a heated temperature, 25 degrees Celsius is a cold temperature. So who is the agent? The agent is going to be Sporothrix schenckii. So Sporothrix schenckii is the fungus that is causing this sporotrichosis. Now, you can also call it sporotrichosis, or you can call it as rose gardener's disease, because this is most commonly seen in people who are handling rose, because this fungus is actually present in the thorns of the rose, right? So they are present in the thorns, and in the clinical history, you will get a person who was working in the rose gardens, got a thorn prick, or they got a splinter prick. So these are all the histories that you will get. So you will get a history of thorn prick, or you will get a history of splinter prick, right? So this is the history. Just remember, sporotrichosis, everything is about a flower. So rose is a flower, everything is about a flower. Now, in this, what happens is that the person once gets infected or injected by this fungus, what is going to happen? Subcutaneous granulomas are going to be formed. Subcutaneous granulomas are going to be formed that are going to spread all across the lymphatics. And the person will have a very cord-like feeling. So I'll just draw a picture for you that suppose this is the leg of a person, right? So this is the leg of a person who got infected here. Now, what is going to happen? This fungus is going to move all along the lymphatics, and it is going to produce these round colored granulomas or subcutaneous granulomas, but all in a state, all in a kind of a line, because wherever the lymphatic drainage is taking place, this fungus is moving and forming granulomas all along. It is not going to be a random placement of the granulomas. It will follow a path, because wherever the lymphatic drainage is going, the fungus is going to go along and start producing subcutaneous granulomas. And on this, if you touch this whole thing, if you touch this, you will feel it like it's a cord, like it's a cord-like feeling. So that is why you will have a cord-like feeling, and it is going to spread all along the lymphatics. Now, if I do a histopathology, what will I see? If I do a histopathology, I will see a yeast cell in the center, and then I'm going to see the inflammation coming out like this. So this is also looking like a flower, and it is called as asteroid body, right? It is called as asteroid body. Again, if I end up doing the microscopy with the LPCB stain, which is lactophenol cotton blue, what am I seeing? I'm seeing very cute flowers, right? I'm seeing yeast cells and I'm seeing flowers, so they will give a flower appearance. So remember, I told you how everything is about a flower, flower appearance. Asteroid body is looking like a flower. Rose garden is a flower. Everything is about a flower when it comes to Sporothrix schenckii.